The politics of Obamacare. Next. And welcome to the Stan Simpson Show, a program about Connecticut people, compelling issues, make it a point to drop in every week. The Supreme Court has reaffirmed the legality of President Obama's overhaul of America's healthcare system. The question now is, what does it mean for America? And what does it mean for the president? We'll talk about the ruling with healthcare advocates Dr. J. Nwando Olaiwola and Francis Padilla, the Executive Vice President of Universal Healthcare Foundation of Connecticut. We'll also talk about the political impact of the Supreme Court ruling and whether it will influence the presidential elections. University of Hartford political science professor Bilal Sakou joins us for a conversation. But first, the Supreme Court has spoken, as we all know. Francis Padilla, Dr. Nwando Olaiwola, welcome. You know what the verdict was. Let me ask you a question. Were you guys honestly, secretly hoping that they would overturn the ruling? Or did you really want them to adopt this? Well, we were certainly hoping that the law would be upheld as constitutional. And I ask that question because we know that the bill that's passed now is flawed. And there was some thought that if the Supreme Court overruled, it would give the president a chance to craft a different, better bill. That's why I asked that question. This law as it is now, is this the best effort that can be done by the president and by the country? The reality is that there is, it would probably have been very difficult to begin all over again if the law had been overturned completely. For Connecticut, we have been working on health care reform for a long time, and in our preparation of expectations for what the possible outcome could be, we felt that in Connecticut we could keep going. But there is always a role for the federal government. So it is, in our opinion, much better that the law has been upheld, and what needs to be improved needs to be worked on over time, and can be. Well, both of you are advocates, so that's very clear, right? So tell me what you like about it being passed, and tell me what gives you trepidation about it still being on the books.
So for me, my organization serves a large number of uninsured as well as underserved patients throughout the state of Connecticut. Community Health Center Inc. Yes, absolutely, absolutely, and really enjoy and appreciate the work that Francis and her group do. But what has changed now in this game is that we have so many more people, millions of residents in this country that have no access to health care, and so giving them access to health care and high quality health care is a huge first step. You know, one of the things that I think is important is that there are a lot of other provisions in the bill that people are not necessarily talking about or not getting a lot of attention. And there are so many other... Such as dependents remaining under their parents' coverage until the age of 26, or the removal of the barriers for people that have pre-existing conditions. Those are the kind of things that are very exciting. I think that they went pretty far to adopt those. And I think now that you have a large number of people that are going to enter the healthcare system, the new questions will be, how do we make sure that the care is equitable across the board and the care is high quality? How do you make sure that happens? Well, it's really important that we focus on improving the quality of care and improving the way that we reimburse for care so that we begin to deal with some of the cost issues. One of the major problems in our country is that the cost of health care is it just continues to rise unabated. And are we talking about abuse here when we talk about this health care cost? I mean, a lot of people frankly say there's a lot of corruption in the costing of this. What do you guys think? You're on the ground there. What are your feelings? There is, you know, there's always waste and fraud. However, the real problem with our health care system is that it is set up with incentives for us to pay on units of service as opposed to what outcomes relative to people's health really are achieved. Because so in layman's language, sure. That means what? Give me an example of it. Well, we go to the doctor. We go to the doctor for one thing, then we get sent for a test, then we come back to the doctor, we get sent for another test, we go to another doctor who orders another test, who doesn't talk to the first doctor. All of these are real inefficiencies in the system. Right. And it costs, right? And that adds costs to the system. We also don't emphasize prevention. We have a sick care system as opposed to a well care system. We don't emphasize prevention. We don't emphasize management of chronic illness as
as well, which is where a lot of the cost is in healthcare, in the healthcare system.
How would the public option have helped? This was passed, and there was a lot of talk about having a public option. And briefly explain what the public option would be, and that's still a critical flaw in this law as is now. We'll hear from both of you.
So, you know, I think one of the things that I think is that having people that have the ability to choose, you know, what they want, and if they would like to access the healthcare system, is still in a sense discriminatory, because you will still have the people that are most needy, that are the sickest, be able to access it, and those are the ones that are obviously going to say, you know, sign me up and get me care. But what Francis is saying is that saying everyone needs to have it, and it's as important to care about prevention as it is to care about when you're about to lose your limb from the complications of your diabetes.
Right. But what is the public option? What is the public option?
So the public option is really a public health plan that is not driven by the same incentives for profit and return to shareholders that are private, for-profit commercial insurance.
So you get a better bang for the buck.
Right. With a public plan, you are able then to focus on designing benefits that really emphasize prevention and wellness, and designing different ways of reimbursing for services that help to minimize the duplication and inefficiencies in the system.
So isn't that still a big flaw then, as we say that? That seems like a pretty promising.
It's missing.
Is that something that's coming down the road, or?
It's missing from the ACA. However, there is a provision.
ACA stands for?
The Affordable Care Act.
Okay, all right. Well, exactly.
Great. There's a great provision in the Affordable Care Act that allows co-ops, member-owned and operated cooperative health plans to be created. And this got slipped into the ACA almost at the end.
Good thing or bad thing?
It's good.
Why?
It's very good, because it allows for the creation of a nonprofit, member-owned and oriented health plan.
It could be cheaper.
That can be cheaper, that can also focus on some of the care innovations that are being seen right now in some of the big employers' self-insured plans. So you have
another alternate. So it's like
you have an
private
alternative.
Right.
You have an alternative. In 2014, well, first of all, let me say that in Connecticut, just 3 weeks ago, we received a $78.5 million loan to the Connecticut State Medical Society to start Healthy Connecticut, which is going to be a nonprofit health insurance plan organized as a member co-op.
Okay, so
that's a good thing for our state. We have not had a nonprofit plan in Connecticut in about 30 years.
Okay, doctors have bought into it, and you all, the Community Health Centers, Inc., have signed off on this as well?
Yeah, I mean, we're excited about that. We were very excited to see that funding came to Connecticut.
So this is brand new. This is happening as we speak then, this funding. And when will it actually launch?
In 2014.
Okay, 2014. So that will give another option that should be better bang for the buck and more alternatives for the
Exactly, so that people have more choice. So when they go to the Health Insurance Exchange, which will be started in 2014, they can then choose between a commercial plan, and depending on their own needs and their ability to afford it, they can choose also between a commercial plan and a nonprofit plan.
That's a pretty big deal then, right?
It is absolutely a big deal.
Okay, so we'll talk more about Connecticut's role in being at the head of the reform movement in Connecticut when we come back. Don't go away, folks. The Stan Simpson Show will continue. We'll also talk about Justice John Roberts and his role in the landmark Supreme Court ruling, and how Connecticut, again, may play a role in being a leader in the health care reform movement. Catch us 24/7, ctnow.com/Stan. Like us on Facebook, follow us on Twitter. Don't go away.